Ali is a weight loss supplement that is designed to help you reduce your weight and cholesterol levels. This product also helps you lower your blood pressure. It is recommended for people who are obese and overweight. Reduces blood pressure. The Ali is an overtly marketed prescription drug that promises to lower blood pressure in the long term. As a bonus, it also helps control cholesterol. It is not for the faint of heart though. Taking the pill with a balanced diet is best. Despite its laudable promises, it isn't for everyone. A proper medical consult is in order. To make sure you get the most out of your medication, you need to know your medical history first. If you're not lucky enough to have a trusted doctor on call, a visit to your local drugstore might just be the ticket. Besides, you're likely to spend less if you know where to look. Plus, you'll feel better about yourself. Of course, you'll need to take your medicine. Ali is not a cheap prescription, so you'll want to get the most out of your money. Luckily, there's a bevy of reputable online providers to choose from. You can even try out a free trial of the product before committing to a subscription. Some of them even offer a money-back guarantee. Be sure to compare prices before buying. In addition to the pill, you'll need to commit to a balanced diet and lifestyle. For most, that means no junk food and at least a few days a week at the gym. You can even try out one of the many online workout programs for a few bucks. Reduces cholesterol? If you're looking to lose weight, you might want to consider taking an Ali pill. The product is a prescription drug that can help your waistline feel smaller by blocking out 30% of the fat you consume. It's not for everyone, but it can make a difference. Taking the pill as directed is the best way to go. Ali can be taken in pill form or as a supplement to a healthier diet. Taking the pill with a high-fat meal may prove to be a recipe for digestive ills. However, if you eat the fat-free version of your favorite dish, you can rest easy. To get the most out of your Ali pill, you'll need to be a little more proactive. Whether you're trying to slim down or simply maintain your current weight, your best bet is to get more sleep, cut back on caloric intake, and stick to a well-balanced meal plan. For the most part, you'll be happy you did. In the long run, you'll be rewarded with a healthy body and improved self-confidence. Plus, you'll be less likely to suffer from depression, irritability, and other ailments common to the obese. The My Ali website is a good place to start. There are hundreds of recipes, workout videos, integrated shopping lists, and more. You can also set up an account and track your progress. Using the site's handy features will help you find out what works for you. Having a better understanding of what works for you is the key to losing weight and feeling better than you've ever been. This might seem like a daunting task, but it's not as difficult as you might think. Reduces oxalate production. Oxalates are metabolic byproducts produced in the body when it is using food. When waste products accumulate, they are excreted through urine. If these wastes get too concentrated, they may cause crystals in the urine. This can lead to kidney stones. The amount of oxalates in your urine can be determined by analyzing the organic acids test. Oxalates are found in plant material, as well as animals. Some healthy individuals may absorb a small percentage of oxalate from their diet. However, if the amount of oxalate exceeds a certain limit, it can lead to oxalate sensitivity. It can cause pain, depression, and even an increased risk of cancer. Medications and dietary changes can help alleviate symptoms. But if you have an autoimmune disease, such as Crohn's or Hashimoto's, oxalate sensitivity can be a serious problem. Oxalate is an insoluble ion that can be dissolved in acidic conditions. During acidic decomposition, iron oxides such as Fe2O4 form. In turn, oxalate ions are precipitated, resulting in the extraction of oxalate from processed solutions. The molar ratio of iron to oxalate, Fe/Fe3, is an important factor in the precipitation of oxalate ions. For example, when Fe/Fe3 is 2, nearly 100% of oxalate ions can be precipitated. On the other hand, when the molar ratio is 4, oxalate ion precipitation is significantly decreased. Oxalates can also be found in plants, and they are often complex with calcium. Calcium and oxalate can be toxic at high levels. So, eating a low oxalate diet can help you to manage oxalate levels. Adding calcium supplements, conjugated bile acids, and probiotics can be helpful in decreasing oxalate load. boiling can reduce the oxalate content of vegetables. Increases oxalate production in the kidneys. Oxalates are metabolites of the body. They can be formed from a variety of foods, including beetroot, spinach, and rhubarb. The concentrations of oxalates in these foods vary. It is recommended that oxalates should be consumed in moderation. Excessive dietary oxalate intake has been linked to the occurrence of kidney stones. However, there is little information on the actual mechanisms of oxalate formation. Therefore, there is an ongoing need to study the role of oxalate in kidney stone development. The synthesis of oxalate occurs through enzymatic and non-enzymatic reactions. It is absorbed through transcellular anion transporters and paracellular fluxes. These factors, along with absorptive fluxes of dicarboxylic acid, influence the rate of oxalate synthesis and absorption. In healthy subjects, AA contributes to approximately 40% of oxalate excretion. AA has been shown to act as an antioxidant in mitochondria. This may decrease the amount of oxalate synthesis. A number of oxalate-degrading microbes are found in the fecal microbiome, and these organisms play a key role in the digestion of ingested oxalate. Oxalobacter formigenes is one such organism. The mechanism by which oxalate is transported from the gut to the nephron has yet to be investigated. However, studies have indicated that oxalate transporters in the proximal tubule are responsible for maintaining the tight regulation of plasma oxalate. Dietary oxalate-induced CKD has been described in mice. In these animals, oxalate crystals have been observed in the glomeruli associated with renal inflammation. CKD is further characterized by fibrosis and cardiac disease. Studies in mice with NLRP3 mutations have revealed that oxalate-induced progressive renal disease is prevented. This suggests that NLRP3 is a key mediator in oxalate-induced CKD. Although oxalate is not the only cause of kidney stone disease, it is a significant candidate. Various factors affect the development of kidney stones, including oxalate, calcium, and divalent cations. Side effects. The side effects of ALI can be unpleasant. In some cases, they are even life-threatening. However, with a little knowledge and research, you can reduce your chances of experiencing some of the unpleasant side effects. ALI is a dietary supplement that helps your body to eliminate fat. It works by blocking the absorption of fat in your digestive tract. By stopping your body from absorbing the fatty acids in food, your body can process the calories from the food you eat more efficiently. ALI also works by preventing the pancreatic and gastric lipases from breaking down dietary fat. These enzymes are necessary for the digestion of fat. As a result, the undigested fat gets flushed out of the body. Some of the most common side effects of ALI are diarrhea and loose stools. When you are taking ALI, you should follow the directions carefully. For example, you should never take more than one pill with each meal. Also, you should always avoid foods high in fat. ALI should only be taken in conjunction with a nutritionally balanced diet and exercise plan. If you are taking other medications, consult with your healthcare provider. You should also be aware of possible interactions with other medications. Using ALI should not be used during pregnancy. Although it is not known for certain, there are reports of fetal harm from weight loss. If you are pregnant, talk to your healthcare provider before using ALI. Regardless of your condition, a healthy diet and exercise plan is your best bet at maintaining a healthy weight. The best time to take ALI is up to 1 hour after a meal. Ideally, you should eat a low-fat meal, with less than 30% fat. We have provided link in description to their Amazon store to check the review before you purchase.